Bismillahirrahmanirrahim. Assalamualaikum everyone. Myself Dr. Mamoona Azhar. My profession, I'm a physiotherapist, and today I'm going to deliver a lecture on the subject of biomechanics. And today I'm going to discuss about common joint injuries and pathologies. So as we all know, we are all clear about joint, its injuries and pathologies. We are just going to revise and restudy all these things which are just affecting our joints, and what are these injuries and what are these pathologies which are most commonly being affected in our joints. So first of all, joints are the parts of our body which support our weight. We have multiple bones in our body and they combine together to form joint. Our joint movement occurs, and this movement is supported and loaded by muscle forces. So the basic joint weight, body weight, is supported by the joints. And the third and very important function which is being produced, as we have to perform movement, we have to do locomotion. So this locomotion is being done because there is the range of motion which is present in our joints. So joints also support range of motion, and this range of motion is present different body segments of our body. As we all know that we have different ranges of our all the body joints, and it is according to our body movement, it is according to our particular locomotion, the way we are just performing all these activities, it is just being designed that way. And it is as it is anatomically different, the same way it's physiologically, and the same way it's in the perspective of movement, it is different from that. Now we know that when the joints are performing these much functions, joints are very basic integrity of our body. So it is very common that these joints become prone to injury. They can have injury very easily. So these injuries can be of two types: acute injury, chronic injury. Acute injury is that injury which just happened and it recovered really fast. But chronic injury is that injury which did not recover really fast and it prolonged its duration. As its treatment, there can be multiple factors for the chronic injury. You did not take the treatment, you did not take the right treatment, or the treatment was not very much effective. These are the reasons that can prolong our injury and convert acute injury into chronic injury. And also reasons for the injuries are infection and degenerative diseases. There are also multiple type of diseases. As you know that the diabetic patients, these kind of patients are really prone to joint aches and body aches and muscle aches. These are the things, these are the generative and infectious diseases which are just making our body prone towards the injuries. So injuries are very common part because many type of functions are performed by a part of our body, so they are really prone towards the injuries. So now we are moving towards some of the diseases which are, or some of the injuries which are occurring most commonly, and the number one in that situation is sprain. What is sprain? The thing you should remember always about sprain is that it happens to ligaments, tendons and connective tissue. Basically these are the injuries which occurs to tendons, ligaments and connective tissue. And how it happens? It can be due to abnormal displacement or twisting of articulating bones. For example, a sudden jerk occur at any joint of our body. It can lead towards the tendinous or ligamentous or connective tissue injury. So that would be considered as sprain. Now the other question is, can it happen to all joint or any joint? Yes, the answer is yes, it can happen to any joint of our body. Now the next question leading towards that is, which is the most common joint which is being affected from this? So the most common joint which is affected or which is having the mostly sprains, or where occurring most of the sprains, that is ankle joint. Ankle joint is a joint which is bearing most of the weight of our body. So when there is higher weight of the body, there are increased chances of the injury. And if we particularly get to know about the ankle joint and which part of the ankle joint which is more prone towards the sprain, that is lateral ankle side. Why is that? Now, first of all, we identified that from the whole body, from the whole body joints, the ankle was more prone towards it. Now, from the ankle, we are going to know about why the lateral aspect is more prone towards the sprain. The reason is there is less ligamentous support on the lateral side of the ankle. The more ligaments are present on the medial side, but the less ligaments are present on the lateral side. When this scenario happens, that is the why when the stability is not being maintained in the both sides, so there are the more chances of injury. It is just like that you are just maintaining a building. You have a roof of your house and it has two pillars at one side and one pillar on the other side. It is obviously more clear that there would be more injury or more chances of the breakdown on the side which is having the less pillar. The same way it is occurring on our ankle joint. Next, we are moving towards the classification. How we can classify sprain. There are some degrees which can classify our sprain. There are 3 degrees of sprain: first degree, second degree, and third degree. And these are depending upon its severity. The first degree is having minor symptoms, second degree is having moderate symptoms, and the third degree is having severe symptoms. So as soon as well as the degree is increasing, the way the severity of the symptoms is increasing. So first degree sprain is the sprain which is the mildest form, in which slight symptoms of tenderness occur on the part which is being affected, and there would be slight tenderness and slight swelling on that region. Range of motion are not being restricted in that kind of in first degree. Then moving towards the second degree, what happens in the second degree? The bruising pain, decreased range of motion, swelling, localized tenderness. These are all the symptoms which occur in the second degree. As the first one was having the less symptoms, the second one increased in symptoms as it decreased the range of motion of the body and it increased the pain. Now moving to third and the most severe form. What happens in the third form? There is partial to complete tearing of the connective tissue. So when there is complete or partial tearing, obviously we are very much clear that there would be really high pain, there would be really limited range of motion we will have in our body, a lot of swelling and a lot of tenderness would be present there. So these are all the symptoms which make us clear that what is the degree of the sprain. Now when we are clear about the sprain, what it is, how it happens, and its degrees, its classification, its symptoms, we are moving towards its treatment. What is the treatment for the sprain? In the treatment of sprain, rice is being used. It's not that rice we eat daily. It's another protocol, it's another technique which is being used in the field of physiotherapy. Rice means rest, ice, compression, and elevation. It is a protocol which is being used in our daily perspective. You might know about it or you might not know about it, but let me just tell you clear about it. For example, you are having a sprain in any area of your body. Now what you will do is you will have some rest in that part of the body. Then you will ice that region which is having the sprain. That icing can be done for 5 to 15 minutes or 10 to 15 minutes. Then the compression is also a very important part. For example, you are having a sprain in an area. What you will do, you can use the compressive bands and compress that area. Then elevation is done. Elevation is particularly important factor which can be missed sometimes, but elevation of that part is being the necessary component. For example, the person is having the ankle sprain, so what you will do, you will have the rest, recommend rest to the patient, icing of that particular region, compression with compressive bandage or the socks or the tightened socks you can use, and then you will elevate that region. For elevation, what you can use the pillows to put downward just to elevate that region. So this is the treatment for the sprain. Now we are clear about the topic sprain, and we are moving towards the next topic, which is the next injury which is occurring mostly in our joint, that is dislocation. What is dislocation? Dislocation is displacement of articulating bones at a joint. Now the bones are being displaced from a joint. For example, this was a joint, it was having its articulating cartilage, it was covering with the synovial fluid, membrane, and all these things which we have discussed in the earlier lectures. Now what happened? The displacement occurs in articulating cartilage. So this was the actual position of the articulating cartilage. It happened like this. Now you might not be, yes, the way it is. It was actual position and it displaced like this. Now the position of the joint is not being maintained as the displacement has been occur in the articulating cartilage. So it can occur due to fall, it can occur due to any trauma or any injury or any accident or any mishap which is having the large magnitude of force. The fall can have the large magnitude of force, or the trauma can have the large magnitude of force, or the accident can have the large magnitude of force, or you can also have the road traffic accident. There can be any reason for that, or there can be any game you are playing the first time, or the different technique you are just using in any game, in any sport, that can also lead towards this kind of injury. Now we are moving towards the common sites. As we studied the common site for the sprain, that was the ankle joint. Now what are the common site for dislocation in our body? The common sites for dislocation, or the common joints for dislocation in our body, is shoulders, fingers, knees, elbows, jaws. What I said, I am going to repeat: shoulders, fingers, knees, elbows, and jaws. These are the most common sites which are really prone towards a dislocation upon the application of the large magnitude of the force. Now what are its symptoms? Its symptoms are joint deformity, intense pain, swelling, decreased range of motion, and there can also be numbness in that region, or in that particular region, or the region following that region. There can be numbness or tingling sensation in that area. So these are the symptoms which are being produced in the dislocation component of the injury. But with these symptoms, what else can happen? There can be damage to the surrounding tissues which are present in that region. For example, as I just mentioned, that the joint had its synovial membrane tissue. Surrounding that, there are the nerves, the ligaments, and the muscles which are present there. They can also have injury. So when they will have injury, it will just increase its severity, increase its pain, and it decrease really the range of motion, and the patient recovery chances gets decreased, or the recovery rate is being decreased. So what is the treatment to treat such kind of condition? For example, the bone is just being, the articulating cartilage is just being displaced from the position. What we will do, the technique is being used is called reduction. Reduction is a process which is particularly, the name is used in the medical field, that we are going to reduce our joint. The joint displaced and we reduced, and this reduction is being done by the medical professionals. And this reduction is firstly important just to decrease the pain, regaining the range of motion, and very important factor which can be missed sometime, that is regaining the blood supply. As the blood supplies, or the arteries and veins are passing through a region and there is a trauma in that region, there can be compromise of the blood supply. So that compromise can lead to really very bigger pathologies in the later ages, or in the later hours of the injury. So that is really important to reduce that joint. Now we are moving towards the next and very important condition which is occurring in that process is bursitis. For bursitis, we need to be clear about the bursa. We have studied the bursa in the recent lectures. You guys can go back and look into those lectures and revise what is bursa. For meantime, let me just give you a bit hint about bursa. The bursa is a sac filled with fluid. It is just a minor sac which is filled with fluid that function to cushion some point. For example, you guys might know about the balloons. You fill the balloon with water and you put it somewhere. You might have guys played with those balloons by pushing them. As you exert pressure, they are just bearing the pressure just by, as for example, this is a balloon, I'm exerting pressure. What it will do, it will expand itself. It will not exert pressure on the other side of the thing. It will just expand itself. So same way these sacs or these bursa are functioning. uh, Now the important point to consider, where these cushions are being present. These are present where muscles or tendons slide over the bone. Now this is a part, for example, this is the bone and the muscle or tendon slide over this region. Now this is really sharp region and the muscle is crossing this region this way. Now this sharp end can damage that part which comes in contact with the bone. Now for that thing, the cushion is being placed in that region. For example, this is the small cushion which is present in that area, and over that it is being crossed. So this cushion will reduce the functioning. This is just this way. For example, this is the end of the bone. You maintained a cushion, small cushion. It is not just like that, I'm just giving you an example. And this is the blood supply, which is, or this is the muscle, or this is the tendon or connective tissue passing through the joint. So it is really easy. For example, if it's exerting pressure, the pressure is being exerted to this cushion, not the other region. So it is really easy when the cushion is being present. So bursa can help in that situation. Now the bursa, what does this bursa do in our body? It makes the gliding forces or gliding surfaces frictionless. When there would be no friction, it would be really easy to perform the movement. Bursitis can have some symptoms, and these symptoms are painful, increased or decreased movement, and increased aggravating problems. Now, what is bursitis actually? It is the inflammation of bursa. It can be done due to any reason, any trauma, any injury, or repetitive injuries. So in that condition, when the bursa is being inflamed, what will happen? If you are performing increased movement, there would be increased aggravating problems. So movement should be decreased in this kind of situation just to treat it. And its causes, as I just mentioned, that overuse, repetitive or acute injury can be the causes of the bursitis. Now, what is the treatment which we can use in the bursitis? The same treatment which we mentioned in the sprain is the treatment which is being done in this process too. That is RICE: rest, ice, compression, elevation. I hope you guys might know in detail, or you guys might clearly know about the RICE treatment. If you guys experience any injury in your family member, in your relative, or in yourself, I hope you can apply this treatment immediately to that person just to prevent from the further injury. Now, we experience the runners in our daily life. We see the runners, we see the sports person which are doing the sports activities, especially the runners. When, for example, if you are the person who want to run really fast, or you want to be a runner, or you want to lose the weight, and you use the technique of running for decreasing the weight, and the first day you are just slowly running, and suddenly you increase your running mileage. What will happen? You are suddenly increasing your running mileage, and abruptly you will have the injury, or you will have the bursitis between Achilles tendon and calcaneum. Achilles tendon is the strongest tendon of our body, and calcaneum is the heel bone which is present in our heel. So there is a bursa present there. So when you are increasing your running mileage, suddenly you can have the bursitis over that region. Now moving towards the next injury which is occurring, which is really common in both young and adults or the geriatric population, um, worldwide and specifically in Pakistan too. It's also having a increased number and increased prevalence in Pakistan. And the injury is arthritis. It is a pathology involving joint inflammation accompanied by pain and swelling. Pain and swelling and joint inflammation. So these are the three basic characteristics to define the arthritis. Along with that, it is extremely common with aging, and there are 100 types of arthritis. As I just told that it is really common, that is the reason I'm just telling you it is having the hundreds of types. There are hundreds of the types of the arthritis, and some of them are really common in the people. The first one type of the arthritis which is really common in the people is rheumatoid arthritis. Rheumatoid arthritis is the most debilitating and painful arthritis. The people having rheumatoid arthritis, their life are being sucked because they're experiencing so much pain. They cannot live without painkillers and proper physiotherapy treatment. Their life becomes just like hell. Because why is the reason that this condition is really painful? It is autoimmune. You guys know about autoimmune. Autoimmune means our own body cells start eating or fighting with our cells. It is just like we have an army. Both are Pakistani army, and they are fighting with each other. And what happens in result? The Pakistan is suffering from that situation. The same way it is acting in our body, our own defense system fight with our own cells, and it results into that kind of condition, and the situation becomes really painful. It is more common in adults, but it's one type which is known as juvenile arthritis, which can also occur in youngsters. So rheumatoid arthritis is most common in adults, but it's one type which is juvenile arthritis, which can also occur in our youngster. Its symptoms are inflammation, thickening of synovial membrane, breakdown of articulating cartilage, fatigue, muscle atrophy, osteoporosis, and systemic changes. So in the words, if we are just telling the symptoms, these are very less symptoms, but in actual situation they are affecting the lives of people really badly. As you know, the osteoporosis is a condition as the bones of the whole body become porous. When the bones are getting porous, you are more prone towards the falls and the injuries. The fatigue level of the body would be increased really high. Then muscle atrophy, for example, these are the muscle, the bulk of the muscle would be decreased. When the bulk is decreased, automatically the fatigue level, the pain level, and the many other situations the patient or the person feels, they are really debilitating and really painful. So these are the symptoms, these are the situations which make a patient or makes the person really painful who is experiencing rheumatoid arthritis. Now moving towards the next type of the arthritis that is also really common, which is osteoarthritis. The first type of arthritis was rheumatoid arthritis, and the second type of arthritis we are studying is osteoarthritis. Osteo means bone, arthro means joint, and itis means swelling. It's bone joint swelling, bony joint swelling. It is the degenerative disease which is really common, and 25% of the population which is experiencing osteoarthritis is the population which is having the age about 18. So it is common in youngsters too, but it can occur in the adults after trauma. For example, a person, a female who was normal at the age of 45, she was not having any kind of arthritis, but after the fall, you can say that the fall from the stair, and then the articulating cartilage had a trauma, and it then led towards the osteoarthritis. It can primarily affect the adults, and it can also affect elderly population. So it can affect both population. The mainly at the risk population is elderly, and the traumatic population which is having first trauma and then can lead towards the arthritis, that can be over the other population, which is adult one. According to scientists and according to researchers and according to these people who are doing the scientific researches, what they call the arthritis is, it is the entire family of disorders. It is not just a single disorder, it is the entire family of disorders in which progressive degeneration occurs. For example, a person is having arthritis. We cannot say that this arthritis will stop right now. No, it will progress with time and it will keep progressing. So that's why it is called the entire family of disorders. In its early stages, what happens? In the early stages of osteoarthritis, cartilage loses its smooth, glistering appearance. The articulating cartilage which is present over the bone, which is really smooth, it loses its smoothness, it loses its appearance, and it becomes rough with the time, rough and irregular. It becomes just like the spikes over the bone, and slowly it fade away or it wear away. Now there comes a point at which the starting point was when the body had cartilage, its smoothness decreased, its glistering appearance decreased, and slowly it faded away as all the articulating cartilage was washed out or removed out from the bone. Now the bones become really bare. The bare part, just because the outer layer or the outer covering which was protecting the bone, now there is no protection of that bone. In result, what will happen to human body in the compensation? Thickening of subchondral bones will occur. The subchondral bones will become thickened. It will have thickening, and as well as it will have osteophyte formation. It will have bony spurs. Now these things, the osteophyte formation, the bony spurs, they create the situation really painful for the patient, as the bony spurs and the osteophyte formation, these are just like the abnormal growth of the bones, and this abnormal growth is not good for our body. So these are the symptoms, the way they are progressing. In the starting phase they are easy to manage, and in the progressive phase they are just reaching to the conditions when osteophytes are being formed. Now its symptoms can be pain, swelling, range of motion restriction, and stiffness. Now the pain and range of motion and stiffness and swelling, these are the basic symptoms, but there is a confusion about two things. We want to treat such condition, we want to relieve that condition. Pain is relieved by rest and stiffness is relieved by activity. So what to do in that condition? The person is experiencing two counter symptoms which are being treated by two counter treatments. One treatment is rest, where pain can decrease, and the other treatment is the stiffness, which can be relieved by the activity. So the physiotherapists need to be really conscious and need to be really alert and need to be really competent to understand the problem and to treat the problem accordingly. Its causes, if we just research about its causes, the pet causes, the original causes, which just can say that is the original or basic cause for the osteoarthritis, that are not clear yet. They are just unknown. But it is being said that it's the habitual loading pattern which creates osteoarthritis in any person. For example, the person who are having different kind of occupations like heavy lifting, farming, or the participation in the elite sports, they people are really prone towards hip osteoarthritis. And if we go towards the detail of knee osteoarthritis, there is no relationship between physical activity throughout the life and incidence of osteoarthritis. So these are the confusing theories which are not being cleared yet. But these are the researches which are being performed the most, which I just mentioned you guys. Now the cartilage is the avascular part of our body, and cyclic mechanical loading for the fluid exchange is very important to deliver nutrients, to remove waste. As the body part, as the cartilage is avascular, how they will get their nutrition? The cyclic mechanical loading, the loading, a bit mechanical loading on the joint. The cyclic mechanical loading on the joint will provide nutrients and remove weights from that region. And in our daily lifestyle, if you are having too little cyclic mechanical loading, what will happen in result? Deterioration of the cartilage will occur, so it can lead towards the osteoarthritis. But in current thinking, in the present thinking, it is just being said that too little movement or too high movement, they are not good for our body. So too little cyclic loading or excessive mechanical stress, they both can lead toward the deterioration of the cartilage, and they can result in osteoarthritis. So what we need to treat that condition is, what we need to provide nutrient to our body is, and give full nutrition and remove the waste from that region is what we should do. Intermediate zone of regular cyclic activity should be done to optimize cartilage health. So this was the all about the common injuries and pathologies which were occurring in our body. If you guys have any query or any question regarding that, you guys can ask me directly. You guys can comment here. I will answer all of your queries and all of your questions. And very important thing to remember that now you are done with the chapter 5. We have completed chapter 5. You guys have your test in the next lecture. So stay tuned and keep studying. Thank you so much.